So to stratify patients, non-muscle invasive bladder cancer patients, we have several staging systems. Some of them are based on experts' opinion, and some others are based on individual patient data. The most popular, the latest, the most recent classification is that by EAU guidelines in their version of 2021. And the main limitation of this certification way is that they only included patients with primary tumors who did not receive BCG. So the rates of progression are overestimated, and this has already been demonstrated by a couple of external validations where you see that if you treat your patients with BCG, they will have better outcomes than predicted by the model. We also published recently a systematic review on the performance of all the classifications, and in general, we saw that the external validations show a low capability for discrimination in terms of recurrence, and unacceptable, but which should be better, capability of discrimination for progression. So there have recently been published some molecular classifications which are far from being perfect, because they, even in the worst prognosis group, around 20% of patients will be progressing. So doing a radical cystectomy to all of these patients will be an overtreatment. And another drawback of these molecular classifications as well is the cost and the how we would be able to implement them in all centers, especially smaller centers. So in the future, I believe that of course, we should and we need to improve these classifications. And in the future, this will probably be done with machine learning, with all the clinical data or some of the clinical data we currently use, integrating with some molecular factors.